You're listening to the Oncology Nursing Podcast, where ONS Voices Talk Cancer, a resource from the Oncology Nursing Society. Through conversations with subject matter experts, we examine the important issues in oncology nursing, from new treatments to patient-centered research to advancements in clinical practice. Join us as we hear from nurses in all facets of oncology care, from benchside to bedside and everywhere in between. Welcome to the Oncology Nursing Podcast.
Hello, and welcome to the Oncology Nursing Podcast. I'm your host, Stephanie Jardine, Oncology Clinical Specialist at ONS, and today we are joined by ONS member Susan Yaguda, Nurse Manager of Integrative Oncology at Atrium Health Levine Cancer Institute in Charlotte, North Carolina, and member of the Greater Charlotte Area ONS chapter, to discuss acupuncture and acupressure and what nurses need to know about these integrative therapies for patients with cancer. Thanks for joining me today, Susan.
Thanks for having me, Steph.
It's so great to talk to you about this. I think this is a really interesting area of cancer care that nurses get to be part of and really help to empower patients to, I'm going to say, take control back or have the ability to have some decisions in some of their care and how they look at symptom management. So over the past few years, we've seen a real influx in integrative therapies in various cancer care settings. I wanted to ask you, what are some steps to safely implementing an integrative therapies program at an institution?
You know, there's several aspects that we need to look at. Primarily, of course, we want to make sure that patients are safe using any type of complementary integrative therapies. And so we really follow the evidence and the research surrounding anything that we want to implement. And then also we need to provide education, not just for our patients, but for our teammates and providers around the clinical relevancy of any type of care that we provide, and ensuring that the intention is not to replace standard cancer care and protocols, but to really help support our patients through their cancer journey. So we make sure that we have a lot of research to back up what we're doing, and then we follow kind of step by step all of the potential pitfalls or challenges that we might find in bringing something new on. And that can be from referring to scheduling to understanding what the therapy is for, how to prepare for the visit, any health information that might impact safety surrounding a particular patient getting that therapy, and then legal issues, consents, and releases that might be required, all sorts of pieces to help make the process go smoothly. And of course, making sure that we're providing good follow-up care and understanding afterwards. So all of our therapies have standard operating procedures in place, and these are vetted not only by our chief physician of integrative oncology, but also through our institution's policy committee. And this is made up of several disciplines. Some medical oncologists, surgical oncologists are involved, administration, of course, nursing. And so it's really helpful to get some different perspectives, make sure we're not missing any areas, or there may be concerns that we hadn't thought of that from their perspective they would think of. And we can just kind of have that all smoothed out from the start. And it just helps with acceptance and endorsement of these things from an institutional level. And then, of course, we review these annually just to see if there's any updates that we need to make sure that we get in there too.
Well, that sounds like a great process. And I really do like the way that you put those policies and procedures through, like you mentioned, through the institution, that way kind of getting that buy-in across the board. What I'd like to ask you next, Susan, is if you can explain the difference between acupuncture and acupressure.
So both of these are methods that are used to stimulate what's called acupoints. And there's literally hundreds of acupoints based in traditional Chinese medicine throughout our body. And these are points on what's called energy pathways or meridians. And again, this is based on Eastern philosophy and traditional Chinese medicine. So acupuncture uses very thin, they're about the size of a human hair, needles to stimulate the acupoint, where acupressure uses more of a firm pressure, even from your thumb or sometimes your elbow, that would be used to massage the acupoint. So acupuncture triggers a stronger stimulation than acupressure. However, both are useful. Acupressure is definitely something that can be done even by a care partner under guidance. Patients can provide these for themselves. Oftentimes, travelers will wear something like those C-bands on their wrists. That's a type of acupressure. And it's something that somebody can do at home for themselves if they're experiencing some troubling symptoms.
Okay. Well, thank you for that explanation. And something that you mentioned in our first question about the development of a program was having the evidence and the research behind therapies that will really help support, folks having the buy-in and understanding how these therapies are used. So can you talk about what research has to say about the benefits of acupuncture and acupressure with patients?
So the research is really promising. It's a bit challenging. I always like to say it's like trying to fit a square peg into a round hole, because we're really trying to mesh two different philosophies of health and healing, being, more of a westernized philosophy of more conventional treatment, and blending that with more of an Eastern philosophy of traditional Chinese medicine. And so researchers need to be well-versed in both, kind of have a foot in both planes, if you will. The studies also that we're finding, though, is really positive outcomes for a variety of symptoms. So there's positive outcomes in some chemotherapy-induced neuropathy, hot flashes that both men and women experience, oftentimes from hormone therapy, pain, sleep difficulties, trying to stimulate someone's appetite, anxiety, and also both can be used definitely for chemotherapy and related nausea and vomiting as well, both acupressure and acupuncture. The challenge is there's not like a clear-cut prescription or protocol. When they do research, they try to establish those, but traditional Chinese medicine takes into account the whole person and any variables that might be going on from one moment to another. For example, not just treatment related, but if somebody's experiencing more stress at home, that can definitely impact their health as well. So researchers, again, they're continually looking at kind of narrowing down those protocols so they can offer up that evidence and that kind of guidance for us in the clinical field to follow. But it's a very exciting opportunity. And I, personally enjoy utilizing both Western and Eastern healthcare philosophies. I think it just kind of brings a richness to the research.
In talking about these two therapies, what safety concerns would there be with acupuncture and acupressure?
So side effects are very, very rare, fortunately. Patients may occasionally experience a slight bruising at the point of needle insertion. There's also a very small risk of infection. And because we work, with a vulnerable population, we do carefully monitor our patients, their ANCs, their platelet counts, just out of an abundance of caution. There is a very rare occurrence. I've never seen it happen in our institution called needle shock, where patients may feel faint or a little bit nauseous even. And usually it's when patients are super nervous about the treatment. They may be exhausted or fatigued, may have even low blood sugar before coming in for the treatment itself. And again, we've never seen this in our institution. And typically they'll just take the needles out and things will resolve on their own. But, we're really fortunate that, as far as safety concerns appears at this point to be a very, very safe modality.
That's really good to know. I think that, that could be something that definitely is a concern for practitioners as well as for patients who are looking at these different types of therapies. Would there be any patient population specifically that should avoid this therapy?
Yeah, and that's always a good point to think about. So definitely people who are extremely needle phobic, should avoid acupuncture. Acupressure might be a good option for those folks. Most will say don't have acupuncture if you're experiencing an active infection, especially if it's a cutaneous infection. For example, a cellulitis, we wouldn't treat somebody until that was resolved. Acupuncturists also like to know if their patients are on any anticoagulation or if they're pregnant. These aren't contraindications, but it's just information for them to know for best practice. And then it's not recommended for patients who experience psychosis or delusions for obvious reasons.
So talking about, give us some information about how you implemented acupuncture and acupressure into the practice at your institution.
When I first started at Levine Cancer Institute, we were only providing acupuncture through private hour-long appointments. And we have an acupuncturist that works for Atrium Health for our healthcare system that we were just, using him to provide the service. And it was a fairly expensive out-of-pocket cost to our patients because although now more insurance companies are covering the cost of acupuncture, certainly not all of them are. And then it wasn't very efficient. So if a patient canceled or no-showed, that was a lot of downtime for the provider. So we looked at implementing a shared acupuncture appointment in around 2014. And what we did was we combined aspects of the shared medical appointment and community acupuncture. And community acupuncture is a very common care delivery, particularly in China, but also a lot of communities now offer acupuncture in this way. For example, pre-COVID, we could see with this arrangement up to 26 patients a day in the shared appointment. So patients would be individually assessed. They would come in at 15-minute increments to allow the acupuncturist some individual time with them to get some needles in and get them settled. But then we could have as many as 4 to 6 patients in our big acupuncture room at one time. And they're in recliner chairs, similar to what you would see in an infusion suite. It allowed for a lot easier accessibility, allowed us to lower the cost, and patients have been really happy with the arrangement. It remains very quiet and peaceful in the room. We provide our patients with an option of listening to some guided meditations on a little iPod if they want. And then we can also just cover them with the Mylar blankets if they get chilly, which is a very common occurrence as you get relaxed. Most people kick back and honestly fall asleep. With COVID, we've had to stretch our appointments out. We took a break from our individual modalities for a bit. But then when our infection prevention allowed us to restart things, but we did need to make some modifications just for safety. We now have 30-minute appointments, so we don't have as many people in the room at one time to provide more physical distancing. So we're able to see now about 14 patients in a full day, which our patients are grateful for. We'd rather be able to see more like we were doing because it does kind of pinch our schedule a bit and getting people in. But whenever we're able to more safely expand things, we definitely will. Our patients, like I said, they don't mind being in a group setting. There's no chit chat amongst patients. It's a very individual session. And like I said, they often are falling asleep, but we've gotten really positive feedback from them. And then our acupuncturists will sometimes teach patients how to use acupressure as an adjuvant treatment in between their acupuncture appointments. So that can be done right there in the shared acupuncture clinic as well.
Thank you for explaining about that, as well as just talking about how things have changed for you guys in lieu of COVID. I know that, so many of practices and institutions have had so many things change, but it's good to know, just hear how you've done that, and also just hear the response for the patients, because I'm sure the ability to still come in and get those treatments when they were really very beneficial to folks, and then to have that time frame when they weren't able to have them, it was probably a relief for them to be able to come back and get some normalcy, probably for what they were feeling.
Yeah, I think you're spot on with that. They definitely appreciated being able to come back in, kind of get tuned up from some of the concerning symptoms that they may have been experiencing that we were able to help with. So I'm really happy that we've been able to safely provide this again.
So how many therapists do you have on staff? And then can you just kind of walk us through their average working day with the patients and how that works out?
So we currently have 3 acupuncturists. They work a variety of, different number of hours per week, depending on the schedules and the needs. So they'll arrive prior to the appointment block, review the schedule, kind of review any labs that they need to be aware of with a patient. We also have clinical staff that's doing that ahead of the appointment as well. And then calling our new patients just to give them, idea of what to expect and all of that. Then they begin seeing patients, as I said, now, 30-minute increments. We have this available at our hub main location in Charlotte, but also at a regional location. And then our system also has acupuncture available privately for patients who prefer to be in a private setting, and, it's more costly to them. So for some patients, they're able to manage that cost. But like I said, most people are very happy with the shared acupuncture setting. So they'll put do their assessment, they'll put the needles in, we'll make sure the patient's comfortable, cover them up if they get chilly, and let them cook for 30 to 50, minutes or so. Take the needles out, and we do a pre and post acupuncture session, symptom assessment, just asking the patient to rate some of their symptoms on a Likert scale. And we keep that in a database so we can also kind of follow patients longitudinally and see how they're doing. And this has become a nice platform to springboard for some research questions as well, but also for us to look back and say, what worked here, what didn't work there with a particular patient's symptom mitigation. The acupuncturist also documents in our EMR, and then that's utilized as reference for follow-up for the next appointment. Or if a different acupuncturist is seeing that patient for the next appointment, then he or she can look back in the EMR and see what points the acupuncturist used and kind of evaluate how the patient felt in between visits as well.
What great data that you have, being able to have that all in your EMR as well, and really just have it to continue to support the program and the benefits that patients have with these integrative therapies.
Yeah, it's been really useful. We've been collecting this for more than 6 years now, so we have a pretty robust database. We've done some retrospective studies on this data, but it's really been, at this point in the game now, a useful platform for determining prospectively what we want to develop, which is exciting, to be able to kind of help move the field forward.
Yeah, that really is. So I'm going to ask you now just a little bit kind of more focused or specific about a specific side effect. And your institution uses acupuncture to treat peripheral neuropathies. What benefits have you seen in these patients?
Yeah, it's been really rewarding to see. So we find improvements in neuropathy for patients who regularly receive acupuncture and are on chemotherapy for potentially neurotoxic therapies. We would prefer to start treating them sooner rather than later in the game. So we find that, and again, this is primarily anecdotal, but we're finding that patients who are experiencing neuropathy and maybe even a year or a couple of years out, we get less of a therapeutic benefit we're seeing than if we're able to see patients even at the time that they're still receiving chemo. We'd like to see if this as an intervention could be something that could help our patients and help the providers, making sure that maybe we can avoid dose reductions or avoid missed doses because of concerns about neurotoxicity. So again, I just think that that's a really important research question to explore more. We also find that if patients, however, have other comorbidities that can cause neuropathy, such as diabetes, sometimes the response isn't as strong as we honestly would have liked to have for them. But it's really rewarding to hear back from a patient who has been experiencing troubling neuropathy that they're able to walk more safely. They're able to even button their shirt up more readily, be able to do a lot of their ADLs more readily because the neuropathic symptoms aren't as troubling to them. So hopefully more to come in this area, not just in our institution, but definitely in colleagues across the United States. I'm just hearing some of the work that they're doing. So it's an exciting opportunity, I think, for us to address a really troubling side effect.
That is really great. I think that, like you said, if you find out that this therapy is able to help keep patients on track with their treatment and without having to have dose reductions, which we all know in those treatments that peripheral neuropathy is one of the side effects that tends to be what ends up happening, is that either they go off treatment or that there does have to be a dose reduction. And, if this ends up really showing that that's the case and you can keep them on, just the end outcomes for these patients, how much greater that's going to be. So that is really exciting work.
Yeah, I'm eager to see how we can move this forward, and hopefully we can be a part of that.
Great. So ONS has the ONS communities, where folks can write in questions and, find out what people are doing across the board. And in our ONS communities, there have been some write-ins or questions with concerns about credentialing for acupuncture. How is this a significant issue, both for inpatient and outpatient settings? And are there credentials that therapists should have for working in cancer institutions?
So acupuncturists should all be licensed per their state requirements. Most licensing requirements include graduation from a 3 to 4 year master's program. So it's pretty robust training program. Chiropractors and physicians can also get an acupuncture credentialing as well. It's a much shorter training. I believe it's 300 hours, but we've had some physicians in our palliative medicine practice who utilize acupuncture because they've had that background. They've utilized it in actually a clinic appointment. Our preference is that our acupuncturists have, some oncology experience and some additional training around oncology. And at our institution, we just provide the acupuncture, but a lot of acupuncturists in their training have much more education around traditional Chinese medicine. And this could be the use of herbs or supplements. And so our program prefers that patients see one of our integrative medicine providers for guidance around that area, just because we know that some of these things can have interactions with cancer treatments as well. And we just, again, want to have that additional layer of safety around that.
Okay, thank you. And if institutions do not currently have a therapist in their facility, where can they find them, or how do you look for them in your area? And are there credible professional organizations for acupuncture therapists or societies similar to ONS that they belong to, where you can find them?
The best place to start would be to check. Each state should have an acupuncture board, like a licensing board, and you can see by region who is licensed in your state. A lot of states also have like an acupuncture society. Again, this is different state to state. You can also go, there's the National Certification Commission for Acupuncture and Oriental Medicine, and this develops the licensing exam that most states use for acupuncture. But it's also a good place to go to just to get more information about who might be available and where they are. It also approves continuing education for acupuncturists. So it's good to see, what's out there. If you had somebody who was interested maybe in partnering with you, but maybe they're lacking in a certain training, just to see what's available that they may be able to take on and further their understanding of working specifically in oncology.
Thank you. I think that's an important piece for folks to know. And I'm sure, as with nursing, all states are different. So it's good to know that that would be the first place for people to look. And as we've been talking about this, you've talked about the importance of the research and the science behind this, the evidence. And I think that it's really important for nurses who are not lucky enough to be in an institution such as yours that has a program already in place and maybe don't really understand what integrative medicine or integrative program has to offer. So what would be some resources for nurses wanting to incorporate this into their practice or even just learn more about acupuncture and acupressure so that they can better be able to educate their patients or even just understand it? Because we know that patients come to us a lot of times with recommendations from family friends or different things like that. So the patients get information from a lot of different sources. So for nurses to have that understanding and resources, where would you recommend?
So there's several reputable sites that and organizations that I do frequently myself go to and also refer others to. One is the Society for Integrative Oncology. In fact, we're forming a special interest group for nurses as part of this organization, but there's also a lot of activity in the society around acupuncture, as well as other integrative modalities. Andrew Weil, of course, University of Arizona, that is an awesome resource to go to. And then there's another organization that it's beyond conventional cancer care, which just provides kind of some very patient-friendly resources. It's BCCC that are useful in explaining kind of some of the safety around things, what to avoid, what not to avoid, and help patients just become more informed about what's available out there. I think that's also helpful for healthcare professionals, including nurses, just to get, especially if you're not familiar with what's out there. Nurses should also check with their state and hospital systems with regard to utilizing acupressure. Different state boards for nursing allow for different interventions under their nurse practice acts. Similar to massage in nursing, some hospitals do train nurses to do certain types of acupressure treatment. So in North Carolina, I know, you have to be a licensed acupuncturist to perform acupuncture, and you have to be consistent with the Practice Act for acupuncturists. But like so many of other things, it does tend to run state by state.
This has been so interesting and informative for us today. I just have 2 questions that I want to finish us up with. The first one is, what are some misconceptions among patients and providers about acupuncture and acupressure?
Many patients say they're scared about coming in for acupuncture because it's a bunch of needles. And like I explained, needles are about the size of a human hair. They hardly go into their skin. And I sort of chuckle when I think about all that our patients go through as part of their cancer treatment. Receiving acupuncture is honestly a walk in the park. And they find after they experience it, oh, that was nothing. And typically they get a good nap out of it as well. I also assure them that they should tell us in any way if they're uncomfortable. We can easily make them comfortable, and that's our goal. Some providers may be skeptical about the value of acupuncture, and we really encourage them to try it themselves. Like, we'll arrange a time for them to come into our clinic and to actually receive it, just to see what the experience is like. And sometimes that's enough to convince them that there might be something to it. But the most powerful influence is when they hear a positive response from their patients. So if they have a patient that has come to us and has had a really positive outcome, good improvement in any troubling symptoms, then that has been the best testimony and the best marketing that we could think of for our institution as well.
What is something about acupuncture and acupressure that's not often discussed, but you wish people knew more about?
Yeah, so several things. I mean, I think one thing is that this has been around for literally thousands of years. So it has some staying power, which tells me that there's probably something to it. But we also have developed a good bucket of research and literature to support it as an intervention. But one thing that sometimes is discouraging to me is that patients hold off getting the treatment. And I understand that sometimes it's just another visit, another appointment, and that's really difficult to consider fitting into their schedules. But if they can make the time for it, and if we oftentimes try to bundle it with another appointment that they're coming in for, they find that we can help them not only tolerate their treatment better, but like I said, potentially avoid dose reductions or missed doses. It can help improve their sleep and just hopefully, help their overall quality of life. So if there's any one point I'd like to get out there to our patient population is that come to see us sooner rather than later, because you may be suffering from some things that we can really have a positive impact on. And we would like to be able to do that.
Okay, thank you. And do you have any final comments?
So I think it's just important to remember that integrative care isn't woohoo. It's not alternative care, which tends to take the place of conventional care, but we really are good partners with our conventional providers that we really want to help support them the best way we can and improving quality of life and symptom mitigation for our patients. And nursing has the opportunity to educate our patients about these resources and to normalize the conversations about them. So we know our patients are getting a lot of information from the internet or from well-intended neighbors or family members, but we would like to just empower them with the knowledge about what's safe, what's evidence-based, so that we can guide them to appropriately use the care that's available and that can really just improve their overall outcomes and their whole experience, not just during cancer treatment, but also beyond.
Yeah, thank you for that. I agree with you. I think that it's so important for us to be knowledgeable about what is out there and available for patients, and how our job as nurses is to improve their quality of care and quality of life with how we care for those patients, and us having that knowledge and being able to help to empower patients to join us in their care, I think is so important. And I really appreciate everything that you're doing, where you guys are, and for your patients, and for sharing your knowledge and your passion with us today.
Thank you so much for having me. This has been really nice to get to talk with you. And I always get excited when we can share some of this information, and hopefully it will inspire others to check it out as well.
Thank you, Susan.
Thank you for listening to the Oncology Nursing Podcast. Tell us about your favorite part of this episode by leaving a review on iTunes or wherever you download your podcasts. For more resources and information about oncology nursing, visit us at ons.org or voice.ons.org.